This is the roundtable on the public health side of rural transportation safety. Sallie, if you could let me know that you can hear me through the chat pod. Okay, perfect. So I believe that we've muted all of our other presenters for now due to the bad echoing. What I'm going to ask is that all 4 of our presenters, you have to make sure that the sound on your computer is turned off. That is what's causing the bad feedback and echoing. So whenever we unmute someone, we will get that until all of the sound on computers is turned off. So I do believe that we are going to try again. Okay, and so Joe, I'm being asked, Joe, if you can make sure that your computer is possibly unmuted, or we may need to have you call in from a different phone. We're getting echoes through your phone, or we get you hung up by accident. Okay, so for everyone else on the phone while we're trying to get started, I just want to remind you all that there are polls on the outside of the presentation. If you wouldn't mind taking those, I'll close those out and talk about those while we're getting all our presenters unmuted. Also in the center bottom of the screen, you'll notice that we have a handout section. And in that section, there is a PDF of today's presentation, and there are also 3 reports that will be discussed from Clackamas County. So for today, it looks like a great majority of the people joining us are joining us from the Midwest, about 45% today. We do have about 30% from the Southeast, 9 from the Northeast, and 18 from the Western U.S. It does also look like most of you are joining us by yourself in a room on your computer. But for those of you, it does look like we have a few groups. So for those of you joining us in groups of multiple people, if you could please send us an email at info@ruralsafetycenter.org, and that will allow us to send you an evaluation after this presentation so that you can receive CEUs and certificates of education. And it looks like most of you are joining us through the computer, and some of you are joining us both from the computer and the phone. And again, I will remind everyone who's joining us through both to make sure that your computers are muted. And we have a good multi-diverse team today. We have a lot of you from state DOTs, local DOTs, tribal government, about 14% from each of those. And then we have about 32% from other federal, state, or local government. We have about 9% from educational institutions, about 4% from private consultants. And so I am going to move us over to our presentation, and then I am going to do a roll call and make sure that we have all of our presenters at this point in time. So Sallie, can you speak? Do we have you now?
Yes, I'm here. Sallie
Perfect.
Clark.
And how about, okay, Howard, do we have you?
I am here. This is Howard.
Perfect. And Joe? Sounds like we still may not have Joe. So Carla, if we can work on that. And then Rob, do we have you as well?
I'm here, Jamie.
Okay, perfect. Okay, so while we are trying to make sure we get Joe on the phone, I am going to start our presentation because I know we're running over time already. So again, a few webinar logistics for everyone. This is going to be about an hour-and-a-half webinar. It'll end around 10:30 Mountain Time. We are recording this webinar today, and it will be available archived on our website, as well as all of the handouts will be available on our website as well if you are not able to download them today. Again, if you are listening on the phone, please make sure your computer is muted. To maximize the presentation today, on the top right-hand corner, you will see 4 arrows that point outward. If you click on that button, it will make your presentation full screen. There's also, as I mentioned a couple of times already, the handout pod at the bottom right-hand corner now. You'll find that. You can download any of those examples. And then we will have 2 follow-up surveys that are vital for assessing our webinar quality. Obviously, we've had some technical issues today, so we would expect that to come up, but we're also looking for content-related information. And so the first one will be sent to you directly following today's webinar. The last question on that survey will also ask you for additional topics that you're interested in. So we are interested in that feedback and what kind of topics you're looking for as webinars. It will also allow you to sign up, as I mentioned earlier, for certificates of education and also, or certificates of completion, and also for CEUs, both of which are free. There will be also a follow-up evaluation that will come out in about 3 months that will let us know whether or not you've taken any of the information that you've learned today and put it into effect at your own organization, whether or not you've maybe put one of these different programs into place at your own company, or if you've taken this and contacted one of our speakers to find out more information. So today's webinar is unique. It will be different from most of the previous webinars that we've done here at the Safety Center, and I do apologize again for all the technical issues that we've had so far. This is a new one that we're trying, where we are opening up all of our presenters and just asking questions and not having them present for 15 to 20 minutes each. They'll only be giving about a 5-minute presentation today. And our agenda for today is to go over our goals and learning outcomes, to introduce these 4 experts to you, and then we'll have discussion of submitted questions. And as time allows, we will also answer questions in the chat that you put in the chat pod. And then we do have a few poll questions that we'll ask you at the very end. So today we will be answering your questions via the chat pod. It's over on the left-hand side. It looks like the slide that you're seeing right now. If you type in your question, I will verbally ask those to our presenters. If you have a particular panelist that you would like to address that to, just put that within your question and we can address it just to one. Otherwise, we will ask all 4 of them for their input if they do have something to say on that particular topic. So the goal of today's webinar is that once you've completed today's webinar, we'll hope that you will be able to explore the different ways public health can play a role in rural transportation safety. And we'll be doing this by learning a few things. We're going to help identify how an engineer and/or planner can incorporate health into a transportation plan. We hope you will understand how an elected official can affect public health in transportation. We hope you'll be able to list strategies used by an injury prevention specialist to improve public health in transportation. And we also would like you to be able to identify specific strategies and resources that can be used for tribes. And in order to do this, each of our panelists is going to address each of those things. So a few brief notes on transportation and public health. Transportation affects public health in many ways, and all of this information is available through FHWA's Health and Transportation webpage. We will provide you a link to that webpage at the very end of this presentation today, along with several other resources that we are also going to be talking about. So transportation affects safety. All of us know that motor vehicle crashes are a large number for injuries and fatalities, and so by working on making things safer, we can decrease the number of injuries and fatalities. Through air quality, when we're planning for transportation, we can decrease the amount of emissions that a vehicle will put on air quality, or also by introducing other modes such as non-motorized modes to improve air quality. Transportation affects physical activity as well, again through those non-motorized modes and getting people out to bicycle and also walk around. But it also provides access to goods, services, and opportunities. So things such as healthcare, how to get people where they need to go, how to get them healthy foods, how to get them to recreational opportunities so that they can also do more physical activity. And lastly, through noise. When we do planning for transportation, we can affect the level of noise as well and make sure that it's not disrupting people's sleep. So opportunities to address health through transportation. This can be done in several ways, and again, all of these ways will be discussed by our expert panel later today. So by including health as a vision and transportation planning process, by considering health when prioritizing these transportation improvements that are going to be put into place, by promoting health through policies and funding, and another one is to create partnerships between departments of transportation and metropolitan planning organizations and state and local health departments, so to work together to put transportation and public health programs together. And one of the other things that we will be talking a lot about today, so we wanted to make sure that everyone had a good background in, is the Towards Zero Deaths. This is a national strategy that is used for a multidisciplinary approach with all safety stakeholders. So not only the people who own and maintain and operate roadways, but also those who educate users about how to use them, those who are enforcing the law, those who are addressing safety culture and how to use a roadway safer. So all of the different stakeholders, much like all of the different ones that we will hear from today. The Towards Zero Deaths approach also uses the Hayden's Matrix, and this was a tool that was developed to apply public health principles to a highway safety. So again, you're seeing how public health and transportation are merged together. And the Hayden's Matrix talks about road user, safety culture, and the vehicle. And you'll notice on our Rural Safety Center website that we have put all of our resources that we have available into these 4 categories, and so that you can find them using the Hayden's Matrix as well. The Towards Zero Deaths approach also encourages a transportation safety culture, and this would be improving, doing programs to improve using seatbelts, trying to lessen the amount of drunk driving that occurs, and those types of things as well. And so we'll hear some more about those from our experts as well. So today's roundtable experts are Joe Marek, who is a county engineer, the Honorary Sallie Clark, a county elected official, Children's Hospital Injury Prevention Program Specialist Howard Hedegard, and an Indian Health Services Injury Prevention Program Specialist Robert Morones. And so I am going to talk about each one of them separately and then allow them to give a 5-minute presentation. I do want to make sure, though, first that we have Joe. Are you on and unmuted at this point?
Can you hear me? This is Joe.
I can. Perfect.
Excellent. Thank you.
Yes, thank you. And we are going to talk about Joe first. So Joe is the Transportation Safety Program Manager for Clackamas County. Joe has over 25 years of experience in transportation engineering, including such areas as roadway design, traffic signal systems and communications, and bicycle and pedestrian safety. More recently, Joe led an effort to develop a transportation safety action plan for the Clackamas County to bring a higher level of awareness about the opportunities to improve the health and livability of the county by working with the users to improve safety and reduce fatal and serious injury crashes by 50% by 2022, and ultimately to zero. Joe holds a bachelor and master's degree in civil engineering from the University of Idaho and has been employed by Clackamas County for 25 years and has also worked in private consulting. He is a registered professional engineer in Oregon and a member of the Transportation Research Board Safety Management Committee, Subcommittee on Roadway Safety Cultures, Subcommittee on Rural Road Safety and Policy, and also the Towards Zero Deaths Subcommittee. And so we're going to give Joe about 5 minutes to discuss his expertise and experience so that people can think about questions they may want to ask to Joe. Joe?
Good morning, everybody. So thank you, and I apologize for the technical glitch on my end. But we developed a transportation safety action plan back in 2012, and at that time we were working with our Health, Housing, and Human Services, or our public health side of the county. And we recognize the importance of health at that time, although we've been on a continuous learning curve since that time. But when we developed the plan, we were working on prevention issues through our Safe Communities program, such as working with youth for drug and alcohol issues, working with law enforcement on alcohol compliance details, and doing school outreach programs. And this is actually through our Safe Communities program, which is under our traffic engineering wing. And as we have evolved from our safety action plan, we started seeing the vast importance of health. And as Jamie mentioned, we have this transportation health tool, which I'll mention briefly, and then some other work we've been doing related to looking at health and safety in all policies. Another project that has been part of our journey in terms of incorporating health and transportation was we worked on a road safety audit about 1.5 years ago, and we combine that with a health impact assessment. And so most of you probably worked on road safety audits. They involve looking at a section or intersection along a roadway and evaluating the safety issues and identifying potential solutions for those safety issues. And so in this case, we looked at a 5-lane arterial, about 5 intersections along it, focusing on pedestrian crossings and bicycle access along and across the road. And so we completed a road safety audit, which came up with about 42 different recommendations. But then we took the road safety audit outcomes and ran them through this health impact assessment. And the health impact assessment focused on access to physical activity, exposure to air and noise pollution, access to health supportive resources, and health equity. And so at the end, after we ranked both the health component and the safety component, we had a table with all these different solutions ranked by both the traffic engineering or safety solutions and the health solutions. So that provided us the opportunity to look at solutions and look at them in the context of safety and health. And so we could pick a solution that was both safe and healthy, or you could look at a solution that was safe but wasn't as good for the health component. The real eye-opener for me in that process is this notion of health equity and transportation equity in terms of how we operate our system. And many of us in our agencies are finding ourselves in this transformation from being a roadway agency to becoming a transportation agency. And so in that, we're giving more consideration to the different modes of transportation, which for many agencies is a little bit newer. But when you look at the health side, it really becomes prominent. So when we look at road designs, what I found from my experience is we can really make our community better or make our community worse depending on what we do as engineers. And so it's really important. And in our county, which is 50% urban, 50% rural, we have many people, both urban and rural, that do not have access to a vehicle. So they're walking, they're biking, they're using some form of transit, they have friends that are providing them rides. And so as I mentioned, we're seeing ourselves really shift from this notion of being a roadway agency to a transportation agency and really looking at this notion of broader level of equity across the modes. And of course, we're working to encourage active transportation because of some of the health components that we've seen around obesity and heart disease and other things. And so there is a way that we can explore this with this Federal Highway Administration Health and Transportation Tool, which was a cooperative project between FHWA and the Centers for Disease Control. And I've provided the website for that tool. Thank you.
Thank you very much, Joe. And again, we will be taking questions after we introduce all of our panelists. So if you do have any specific for Joe, you can just type them into the chat pod over on the left-hand side. And now we're going to hear from the Honorary Sallie Clark. Sallie is in El Paso County, Colorado Commissioner. Sallie Clark was elected President of the National Association of Counties on July 13th, 2015 at the NACo Annual Conference. Active in NACo since 2005, Sallie is a longtime member and subcommittee vice chair of the Justice and Public Safety Steering Committee. She is also a member of the Financial Services Center Advisory Committee, Large Urban County Caucus Steering Committee, and Cybersecurity Task Force. Previously, she served on the Veterans and Military Services Committee, Membership Committee, and Arts and Culture Commission. Sallie's 2015-2016 Safe and Secure Counties Initiative is designed to enhance counties' capacity to protect public safety, support public health and human services, maintain roads and bridges, and build local economies. El Paso County was hit by 2 massive and deadly wildfires in 2012 and 2013. Sallie focuses her NACo leadership to collaborate with and educate other counties on the lessons her county has learned in the areas of emergency preparedness, response, recovery, and communications. Sallie was elected to serve as an El Paso County Commissioner in 2004 and reelected in 2008 and 2012. She has served as board chair and vice chair. She was the fourth woman to have been elected to the El Paso County Board of Commissioners and is the third woman to have served as the board chair. Sallie has owned her own bed and breakfast business since 1986 and previously worked in the medical field. An avid user of social media technology, Sallie has won numerous awards for excellence in public and community service and has served in many state and local leadership positions, including the Colorado Commission on Criminal Injustice, the Colorado Child Welfare Allocation Committee, and co-chair of the Waldo Canyon Fire Recovery Group. Sallie and her husband, Welling, have been married since 1985, and she enjoys hobbies such as cooking, hiking, biking, horseback riding, tennis, golf, and reading. And so, Sallie, we're going to turn it over to you to talk a little bit about your experience.
Thank you very much. Appreciate it. And I wanted to just kind of start by just giving a brief overview of my county, which is El Paso County, Colorado, which includes the city of Colorado Springs. We're 2,200 square miles. We have 8 municipalities. Our municipalities vary in size from about 450,000 within the city of Colorado Springs to about 125 people in the small town of Rama, Colorado. In addition to that, the county maintains 1,900 square miles of county roads, about 1,000 that are road gravel, and the other that are paved. So the other 1,000 road miles is paved roads. So we maintain a lot of different stormwater infrastructure. We have varied sizes of our from rural to urban. And so it provides not only an interesting overview, but obviously some challenges as well. As it was mentioned, we've had a trial by fire. We had 2 massive wildfires, one in June of 2012 called the Waldo Canyon Fire, one in June of 2013, the Black Forest Fire, and then subsequent flooding events related to the fires that we had in 2013, 2015, and others along the way, some that were declared and some that were not. What I'd like to talk about, too, is I am a member of the Board of Health. I'm also the former chair of our MPO, the Pikes Peak Area Council of Governments, and I think this brings up some really interesting perspectives of looking at what safety and security means to our counties and our municipalities within our counties, in that we need to maybe look at new opportunities as to how public health comes into rural roads. One of the things I think that NACo, National Association of Counties, has really focused on is that, every day local officials have to make important decisions to protect our residents' health and safety. County governments own and maintain 45% of the nation's public local roads and approximately 4 out of every 10 bridges. We invest more than $122 billion annually in building infrastructure and maintaining and operating public works in order to ensure that our communities are safe, affordable, and attractive places to live and work. As the president of National Association of Counties, I've made the topic of transportation safety a central part of my presidential initiative, Safe and Secure Counties. Each year, a disproportionate number of the nation's fatalities occur on local roads. In 2013, more than 12,000 people were killed on local roads across the U.S., almost 3 times that of fatality rate of the interstate highway system. So as local officials, we have the opportunity to work on all kinds of improvement projects and expand our outreach to include public health and the role of public health in our transportation system. If I were to look at the issues that we've faced here in El Paso County with regard to the flooding, post-fire flooding essentially, and the flooding events that we've received, there have been major impacts on our road system, whether it's debris and stormwater runoff, which requires, obviously, there's a health component to that. In addition to that, we had a death on one of our highways due to post-fire flooding, and have worked very collaboratively with our State Department of Transportation to expand our stormwater facilities along a major interstate highway, Highway 24 West, which goes up through the mountains just west of Colorado Springs through Manitou and up to the mountains to Teller County, our partner county to the west. So in addition to that, one of the things that we've noted as we related to some of the flooding events, the health department had to step in to provide tetanus shots. We've tried to work with them at the table regarding stormwater, and in addition to that, septic systems that were washed away and or damaged by our fires. So I think that as we look at the MPOs and how we better work with our metropolitan planning organizations nationwide, we really need to bring public health into that discussion because I think there are some opportunities that we may miss if we're not able to start those discussions. And so this, I think, is very important for us nationally as a local official to make sure that we are looking at this from a higher perspective, how we expand our ability to look at safety, not just from a medical perspective, but also as a public health perspective with regard to the health and safety and welfare of our communities. I think I will wrap up there at this point, but just to let you know that we value at the local level your county commissioners, your city council members, your mayors, your executives at both the county and the municipal levels are really trying to make sure that we look at things from a broad perspective and that we incorporate as many different stakeholders at the table to address the issue of safety and transportation.
Thank you very much, Sallie. And our next panelist is Howard Hedegard. Howard has served as the Highway Safety Specialist for the Injury Prevention Center at Dartmouth for the past 8 years. In this role, he chairs the Buckle Up New Hampshire Coalition, the Traffic Safety Conference Planning Committee, and co-chairs New Hampshire's Teen Driving Committee. He has been instrumental in developing New Hampshire's peer-to-peer teen driver program. Howard is the lead instructor and instructor trainer for the New Hampshire Traffic Safety Institute. He is certified to instruct many of the defensive driving courses provided by the National Safety Council and has taught their defensive driving attitude course throughout New Hampshire for the past 16 years. In 2010, he was chosen from over 9,000 instructors nationwide as the National Safety Council Instructor of the Year for this course. He was also nominated for their Safety Advocate of the Year award for 2015. He has served 3 terms as the governor-appointed member of the state's Traffic Safety Commission and is an active participant in New Hampshire's Driving Towards Zero Deaths and Injuries campaign. Howard is passionate about life and is committed to helping others become the best drivers that they can be. And so we'll have Howard talk a little bit about his experience. Howard?
Can everyone hear me? Good morning.
Yes.
I'd like to begin by emphasizing the Teen Driver Peer-to-Peer program that we have currently. We are actively involved in 15 high schools throughout the state. This program is one that we put a lot of effort into because we believe that helping our novice drivers when they first become licensed to become the best drivers that they can possibly be and to understand the true risks and responsibilities related to driving will pay great dividends throughout the years moving forward. And we are pleased to say that the program's been in effect for about 4 years, and we're pleased to say that during this past 18 months, we went almost 18 months without losing one 16 or 17-year-old to a motor vehicle crash. And just about 2 weeks ago, unfortunately, we had a young man on a motorcycle who lost his life at the age of 16. Typically, we lose 3, 4, 5 in a year's time, and we're hoping that this is a measure of the effectiveness of our efforts throughout the state. The program began with an All-State Foundation grant about 4 years ago that allowed us to work within 3 high schools, And then we were able to obtain funding from the Department of Transportation through their Highway Safety Improvement Plan monies that allowed us to operate for 3 years. That is now coming to an end in the 15 high schools. We do believe that our Office of Highway Safety will continue the funding effective October 1. The only difficult piece with that is the fact that it's year-to-year funding, so it leaves some uncertainty as far as long-term planning. We have been successful in many ways. We have a strong evaluation plan that goes that's implemented that was designed before the program actually went into effect. And we do see significant increases in seatbelt use and in reducing distracted driving, which were really two of the primary focus areas. And we'll continue that program. One of the things we want to do and are working on moving forward is creating a toolbox, a resource that we can send out to all of the high schools so that they can use them in their school advisories or larger assemblies, so that they would have information that they can share with the students to create conversation around the importance of highway safety in many various ways throughout the school year. New Hampshire, as many of you may know, is the only state in the country without an adult seatbelt law. We are currently assessing whether the political climate is right to try again to have a law passed. We have tried, well, on average every 3-4 years recently with no real success. Unfortunately, that translates to the fact that we have the lowest or next to lowest seatbelt usage rate each and every year. It's currently just under 70%. And the offset of that is we have the highest unbelted fatality rate of any state in the country. And that's a shame on us kind of piece from my perspective as the highway safety specialist. Fortunately, we think we're in a better position than we have ever been historically, but we still know it's going to be an uphill battle to make that happen. One of the things that we emphasize throughout our annual state traffic safety conference, and historically that conference has been designed for driver educators, law enforcement, and other highway safety advocates to attend, and we've had on average about 200 people each year. We have new management at the Office of Highway Safety. They would like to see more law enforcement involved and have increased our funding so that this coming year, this next spring, the conference will be designed to emphasize more law enforcement related issues and to allow upwards of 400 folks to participate in the conference. So, you know, that's another important way. And I should mention that New Hampshire, if you don't know, is an extremely small state. It's extremely rural. We have about 1,300,000 people. Our largest city is somewhere around 100,000, and our average community town is about 2,000, 3,000, maybe 4,000 people. So we're very rural by nature. And therefore, getting the message out, whether it's through the Traffic Safety Conference or the peer-to-peer efforts, whatever, it can be somewhat difficult just because everybody is spread some distance from one another. So one of the things that we've been really successful with, and I would encourage everyone to make sure this is happening to maximize it to the extent possible, is a collaborative effort. And it began with our Driving Towards Zero campaign a few years back, and it really played out nicely, for example, with our hands-free law effort. The hands-free law in New Hampshire was passed last July 1. And one of the legislative mandates was that we spend an entire year educating the population of the state and others who drive in and through the state about the fact that the law was going to be implemented. And that collaborative process involved everybody from AT&T to the Department of Transportation, Department of Health and Human Services, New Hampshire Public Health Association, the Associated Grocers of New England, and just public and private, a really, really solid mix of people who cared about the distracted driving, the electronic device piece in particular. And that allowed us to take distracted driving, which was the second leading cause of fatal crashes in New Hampshire prior to the implementation of the law, to the 6th position this past year. So, and that would never have happened, at least not to the extent that it did, if it wasn't for the collaborative effort. So that's my overview, and thank you very much for the opportunity to share it with you.
Thank you very much, Howard. And our last speaker is Robert Morones. He is currently the Acting Injury Prevention Specialist and the Injury Prevention Coordinator for the Western Arizona District of the Phoenix Area Indian Health Service. He is responsible for managing the Phoenix Area Injury Prevention Program, focusing on assisting over 40 Arizona, California, Nevada, and Utah tribes and Indian Health Services staff in the development of community-based injury prevention programs and initiatives. Robert's past positions include being assigned as a Service Unit Environmental Health Officer at the Fort Yuma Service Unit in Winter Haven, California, and as an Environmental Health Specialist at the Centers for Disease Control and Prevention in Atlanta, Georgia. His education background includes a BS in Environmental Health from Wright State University and an MPH from the University of Massachusetts. And so, Robert, we'll have you talk a little bit about your experience, please.
Thank you, Jamie. So good morning, everybody. Again, I'm with the Indian Health Service. So our main mission is to provide a healthcare delivery system to the 567 federally recognized tribes here in the U.S. So this includes preventive services such as disease as well as injury prevention where I'm housed. My primary experience is out here really in the Southwest with reservations in Arizona, Utah, and Nevada. So with injury prevention, we conduct surveillance, and our surveillance data many times has motor vehicle crashes as the leading cause of injury. And actually, motor vehicle crashes are responsible for over half of our unintentional injury fatalities, which is a huge concern for us. One of our barriers is, we do work with the various tribes. Each tribe is unique, how they operate and how they govern themselves. So we really don't have a one-size-fits-all approach at reducing injuries. It really takes some thought and some investigation and some molding and shaping of our programs to see success. What we do rely on, we rely heavily on the use of the public health approach. And again, that's the four-step approach. And we start with conducting injury surveillance to try to identify the leading causes of injuries and their trends and patterns. And then we move to our second step, trying to figure out what the risk factors are or the contributors that are leading to these injuries. Once we've had those identified, we look around and we try to find proven, effective intervention strategies or promising strategies that we can put in place, which brings us to our next set of challenges. We know what works in Atlanta or New York City or Los Angeles. Those have been proven to work, these strategies, but that doesn't necessarily mean they're going to work in some of our rural locations. So some of our chores are to try to take what the literature says works in the big city and mold it and shape it into a different type of program that'll work in our communities. And that typically involves lots of local community buy-in through focus groups and surveys to try to figure out how these programs are going to be received and what the participation might be like. So once we've identified our intervention strategies, again, we implement those, and then we conduct evaluation on them to see if they're effective and if they're reducing the injuries in their communities. So once we've found strategies that work, we conduct lots of different activities. We might find ourselves conducting epidemiologic investigations, like deeper looks on motor vehicle crashes and the causes. We rely heavily on partnerships. That's something that we can't stress enough. We call injury prevention out here a team sport. It requires the use of individuals from multiple disciplines to address the issue, be it PD, behavioral health, community health, IHS, or what have you. What we try to do is reduce the burden on any one person or program, and we've seen lots of success using that strategy. And again, the implementation of effective strategies, we don't want to reinvent the wheel when trying to create programs. We first shop around and see what works elsewhere, and then mold it to what we need it for. We encourage our tribes to collaborate not only at the local level with the programs at the local level, but also at the state level and the federal level. Some of these collaborations are in the shape of funding initiatives. We design the programs, we help tribes find funding opportunities, and we might help them shape their funding application, specifically with their technical part of it. We've seen lots of good successes with this. We've had one community where we've actually reduced the number of fatalities related to drinking and driving by half over a 2-year span, which for us, that's a huge success. We've also assisted tribes with the implementation of a primary seatbelt law. And here in Arizona, our seatbelt law is secondary, but we actually now have 5 tribes that have taken upon themselves to enact a primary law. So that's something that's made us really excited in the past. So that's my overview.
Thank you very much, Robert. Okay, and so for everyone on the phone now, we are going to open this up for questions. You can direct your questions via the chat pod on the left-hand side. Again, if you just type your questions in, we will take those as they begin coming in. But we do have a few that were previously submitted that we're going to get started with while everyone else is typing some in. So the first one we have is directed for Joe, our engineer. Why health, Joe? Why should engineers and planners work with health safety professionals? Why should they be putting all of this together?
That's a very good question. And it was interesting, about 7 years ago, I did a safety presentation. There was a doctor presenting at this conference, and he was talking about how over time health was going to become a more important role in transportation. And I was like, well, that's very interesting. And as I've started to look into that over the years, it's very interesting to learn that a lot of the efforts around global crash reduction actually originated with the World Health Organization. And the World Health Organization found that global roadway crashes was an actual health crisis. And so they work with the countries around the world to declare or proclaim this decade of action for road safety, 2011 to 2020. With the effort to address global roadway safety. And then here in the United States, that's the Towards Zero Death strategies, and there's also the Vision Zero strategies that's being used in many of the larger cities in the country. And so when you think about the traffic crashes around health, you think about some of the, obviously the fatalities, but some of the injuries that occur. Say, take a traumatic brain injury that occurs in a car crash, and that person may experience some level of disability for the remainder of their life. And in many cases, that becomes a burden on the healthcare system. And so there's immense numbers of stories that we can tell about those impacts of severe crashes. And then also on the public health side, you know, we talk about obesity and heart disease and asthma and that basic physical health, and that also actually has an impact on our transportation system. People that are not as healthy may not have as good of reflexes, may not be as attentive, or and so that can also result in potential crashes. And so really, as I see it, health is just a fundamental component of the crashes. And then secondarily, when you look at health, we're also dealing with humans. And so when we look at the crash causes and the diagram that you see, and this is actually for our data in Clackamas County, we find that people are responsible for nearly 100% of the crashes, and you're looking at the person, the roadway, the vehicle, while the roadway is the factor in about 24% of the crashes. And so from this diagram, what really hit me very square between the eyes was that I couldn't, through my best engineering practices, get to zero fatalities. And so I really need to reach out and to talk the conversation about reducing fatal and injury crashes and improving health is really an overall function of the entire county. It's not just me and the engineering department or our law enforcement partners. And so I've really been striving to talk to all the departments in the county about taking this journey together to get to zero fatalities. Thanks.
Thank you very much, Joe. And did any of our other speakers want to also address the why health question as well?
I can. This is Sallie. Am I
Go ahead,
on?
Sallie.
Okay, I just wanted to make sure I wasn't muted. You know, we have some unusual, well, I would say one of the questions that I receive the most when I travel around the country to different states representing National Association of Counties is the question of how recreational marijuana and medical marijuana is impacting our state. And we are struggling with that at a state level as well as a local level on how to really assess the impact of marijuana on drivers and what is actually impaired versus what is not. I think that is a component that will start to work its way to different states nationally as this becomes more the norm versus the exception. I also think that from a mental health perspective that it's important that public health is engaged in this discussion as to how it addresses those who may be under some kind of distress and driving at the same time. We here in our county had actually an accident yesterday that was a fatality on a highway from someone that allegedly was committing suicide. So these are issues I think we cannot ignore, that in terms of the elderly trying to get to their health care visits and not having the sometimes financial means, access to transit to make sure that we impact their medical care in a positive way. And I think looking at more health impact assessments to find out how health in our community is also impacted by our transportation systems. So those are just a few of the things that I think we deal with on a local perspective, the mental health issue, potentially the drug abuse and the things that are happening nationally related to marijuana use, and essentially access to transportation for those who may not otherwise be able to afford a car.
Thank you, Sallie. Those are all great points as well. We do have a few questions coming in through the chat pod. We have two directly directed at Robert, so I'm going to ask those next before we go back to some of the previous submitted questions. So Robert, could you talk a little bit about the strategy that you implemented to reduce drinking and driving? Do we still have you there, Robert? Okay, it sounds like we may have lost him, so we will come back to those questions. We do have another one that came in for everybody. What do you see as the main obstacle to getting public health and transportation people to work together? Is the terminology accident versus crash a major obstacle? Why don't we start with Howard?
We have been really quite successful at getting transportation folks and public health folks and just other highway safety advocates to work together in a collaborative way that has shown some real success. In part because the Department of Transportation 3 years ago took on the responsibility of our Driving Towards Zero campaign and the whole strategic highway safety plan for the state. Although the Office of Highway Safety had a strategic highway safety plan, to be honest, it was typically just kept in a file drawer. And when the Department of Transportation decided to take the lead, a lot of good things began to happen around our state. And it's unfortunate that because of the loss of Highway Safety Improvement Plan funding, that our Driving Towards Zero program has been shelved as of June 30 this year, which hopefully we can keep the collaborative effort going. So, you know, with that, as I mentioned earlier, just such a cross-section of folks from the university system of New Hampshire to the public and private folks, various state branches. It was the first time ever where DOT, the Department of Health and Human Services in particular, our maternal and child health folks around the teen driver issue, and just other state agencies sat at the table together to talk about how is it that we can truly define the problem and therefore create positive outcomes.
Thank you, Howard. And Sallie, do you maybe have some perspective from an elected official's side about what you see as the main obstacles to getting public health and transportation to work together?
From a local,
April Wilkerson, 221. Vince Garcia, 222.
I can hear somebody else
Robert
talking.
Morones,
I don't
223.
know if you can hear that
Patty
too.
Rona, 224.
Yes, I
Julianne June Harvey, 225. Ken Fitzgerald, 226.
Sounds like
London
someone's trying
Hardy,
to call in.
227. Catherine Silent Man, 228. Jimmy Charlie, 229. Curtis Begay, 230. Marcus Seltzer, 231. Darren Osdemore, 237.
Just
and
try
George
and start
Stone,
talking.
No.
How's that? I think
now you can go ahead.
we're good. What I'd like to say is I think that there is sometimes we silo government, and there is a tendency for people to stay within their comfort zones. They want to focus on building more roads versus looking at it from a transit perspective as well. And so I think from a local official perspective, as a county commissioner or a city council member, we have an opportunity to try and tear down some of those silos and to bring different stakeholders to the table to get opinions that may not be in what a transportation planner thinks is the mainstream. And I think from a public health perspective, that's true as well, that public health seems to want to very frequently concentrate on the medical perspective and or looking at certain kinds of things that are more comfortable for them. And so if we bring the two together and try and find those commonalities to break down those silos, I think we'll find that there are more options out there that can cross over from public health to transportation planning, whether that's anything from air or water quality to because we, through our metropolitan planning organizations, we also deal with stormwater and water quality issues. Air quality also comes into play. Bringing those public health officials to the table, I think, it helps to broaden our discussion and say, oh gosh, we forgot to ask this, we forgot to ask public health on this issue. Maybe we should get their input. On the other hand, maybe public health needs a transportation perspective. And so I think that as an elected official, we have an opportunity to work with our respective groups. And because we're so engaged in so many different areas. We have our Board of County Commissioners. In my case, I serve on a metropolitan planning organization as well as a transportation authority, but I also serve on a Board of Health, and I've also been involved in criminal justice issues and mental health issues. I'm able to see it in a more broader perspective and try and bring those folks to the table. And I think this is a great opportunity and a great segue for us to start those discussions to actually impact public health and public safety at the same time.
I think you're right, Sallie, that most of it is just getting the right people around the table to start talking to each other. Joe, do we have you on the line as well?
Yes, I'm here.
Okay, and so how about from an engineering and planning DOT perspective, what do you see as the main obstacles to getting public health and transportation to work together? And do you see the terminology accident versus crash as a major obstacle?
So Sallie really provided a good summary, and this whole siloing issue is very apparent. And what's also interesting about the silo issue is sometimes the siloing issue is due to where the funding is coming from. And so, as an example, if you're in public health and you're working on tobacco and that's how your salary is paid, it becomes difficult for you to actually work outside of that arena. So working with public health, I've seen that quite a bit. And then I think the issue of people in their comfort zones is also an important one. So being able to kind of step outside of your box and begin to talk to others who you wouldn't normally talk to, which particularly for engineers can be kind of hard because we tend to be kind of introverts. And but for here at the county, once we adopted the plan and our Board of County Commissioners adopted it, I kind of took that as an open invitation to begin to talk to whoever I felt I needed to talk to. And so fortunately, management here has been really supportive of that. And the issue of accidents versus crashes, that's more terminology, but I think it's an important distinction because there's always a cause factor, and really a crash is a crash. An accident is considered to be something that really was not preventable, and that's very rare that those types of crashes occur. Thanks.
Thank you very much. And we're going to check one more time. Robert, do we have you back unmuted again?
I'm here, Jamie.
Okay, perfect. So we're going to go back to the two questions that we had come in specifically for you. And one of them was asking you to discuss a little bit about the program you put together to reduce drinking and driving.
Oh, sure. Really that, and again, we kind of fell back to that public health approach to solve that problem. It's not entirely solved, obviously, but, you know, we started using our data to identify the trends and patterns and the burden and especially the magnitude of the problem in that community. We looked a little further and found out indeed the contributors were alcohol and excessive speed. And from there, you know, we shopped around to look at what the community guide said, or what was effective at reducing motor vehicle crash-related injuries with alcohol. And the two big ones were saturation patrols and DUI checkpoints. So we took some time to lobby the tribal councils to get them on board, the tribal police departments to get them on board to increase the number of checkpoints and saturation patrols. It wasn't an easy initiative because many times they're understaffed or underfunded. So we were able to find some funding sources to help pay for overtime or additional vehicles, and that really paid off. Once they started putting the checkpoints up, more saturation patrols, we actually saw, you know, we had people monitoring social media, and it was all over social media. You know, the word was out that if you drink and drive, you were probably going to get caught. So that had a pretty quick effect once it, believe it or not, once it started to hit that social media wave. That was one of our best actual marketing pieces, and we didn't even do it ourselves. So that was probably a majority of it. Using that data to show the impact on the community to the decision makers, and then helping them find a little extra money for those checkpoints and saturation patrols.
Thank you for describing that a little bit further.
Sure.
We also have one other one that was directed specifically to you. It said, I think you said that Arizona had a secondary law, but 5 tribes were able to implement a primary law. Does the primary law apply to any state-owned roadways on tribal lands? And if so, did Arizona have to implement any special legislation to allow a primary law on state highways?
Yes, basically if it's on a roadway within the reservation boundaries, it's a primary law. And there are some MOUs and cross-jurisdiction issues that we've encountered and we've sorted out. Right now we're in the process of evaluating some of those laws, and one of our communities, the usage rate has gone from around 52% up into the high 90s. So that really shows us, and it makes a strong case for us when we go to other communities that, hey, you know, this law really, really works. We've seen reductions in crashes by 60%, or injuries involving unbelted drivers by 60% on some of these communities. now have chosen to enact the primary enforcement law.
Thank you. Our next question is coming in for Joe. Joe, you mentioned health equity and plan or roadmap to bring these together. Was there a focal point, such as your County Board of Commissioners, that played a major role to bring the health and transportation communities together?
The effort to bring health and transportation together is really actually much more grassroots, and so it's kind of came out of our Safe Communities program, which is it's actually 11 years old now, and so that relationship with public health was kind of slowly forged over time, and so we as staff really drove that and have kind of pushed that up in the organization and down in the organization. And so that's how it originated here. So if you think about, having a champion within your agency, there was a champion through our Safe Communities program that really wanted to push for that. And the public health side is very receptive, very great group of folks to work with. And so that really made it much easier as well.
Thank you for that. And our next question is directed at all of you. What would be something you would recommend that can improve rural safety? And why don't we start with Howard?
I want to go back to just the idea of collaboration, strong collaboration as far as making things happen. And I'm looking at a note that Sallie has put up there about are there opportunities for funding if the scope of stakeholders is expanded to include public health and transportation folks. And indeed, we have been successful doing that. We just this past year, there were some public health funds that were made available around the state. And only, unfortunately, we have 13 rural public health agencies in the state, and only one of them took advantage of that. But we blended that money with the Department of Transportation money, and in one high school in particular, the evidence is clear that their peer-to-peer program had greater successes because of that shared kind of stuff. And all of that it would not have happened if we weren't really effectively talking together. And I really believe that we have to, enforcement and education combined really can make a significant difference. It can't be just enforcement, it can't just be education if we're going to reach maximum outcomes. And through the collaborative effort, those kinds of things are happening with our Department of Safety as well.
And how about Sallie? Could you also address this question?
I think that this, the term education brings up an important point where our transportation planning organizations and many times are what we would think of a traditional county engineer role does not always include that educational perspective, whereas public health is in the education business. They do that outreach and education, whether it's tobacco cessation or the issues related to how they're working with young mothers and families and making sure that children are well fed and grow up to healthy lifestyles. That's where I think public health can come in to reach over kind of across the aisle through the transportation piece to take a more active role in whether that's seatbelt use or drinking and driving or some of those things where we traditionally will give it to law enforcement to deal with, so it's more of an enforcement piece, but public health really is an educational piece. The other thing that I hear around the country most often of a concern of especially in rural areas is the width of roadways, two-lane highways where there is no shoulder, there is no place for a large semi to go. In fact, two semis can't sometimes even pass each other because there's no shoulder. There are also no bike lanes so that it can get bicyclists off off of the highways. It increases, obviously, health if folks are encouraged to use alternative modes of transportation to get to and from. But I think that the rural safety issue does have to do with the width of roadways, and some of our worst accidents happen on two-lane highways where they're head-on collisions. So I think that in looking at ways for us to blend in the ability for education and bring in public health from an educational standpoint can be very, very valuable. And if it does open up some additional possibilities for funding, I think that we need to look at that from a more broad global perspective.
Thank you very much. And we did have someone also comment in the chat pod about, Sallie mentioned law enforcement, and someone else had commented as well that law enforcement should also be a part of this conversation as well, and that is absolutely true. You've heard a couple times the speakers have been talking about law enforcement, and they are a big part of this too, as well as the educational component too. Although not on this particular webinar, we will have law enforcement as a part of our August webinar, so if you're able to join us for that one too. You'll be able to ask them some questions and hear some of the law enforcement perspective in that particular webinar. Another question that has been addressed to all of our presenters, and we'll start with Rob for this one, is during the course of your work, has there been a special emphasis on mature or senior drivers since this segment is growing rapidly?
Yeah, absolutely. And one of the, that's a good question actually. So one of the things that we try to address is this issue of knowledge, attitudes, and behaviors. For our senior population, or we call them elders, and many times they are, the primary care provider during the daytime of children on the reservation. Parents are working and whatnot. So they find themselves in the situation of having to transport kids, and so we have educational campaigns and efforts to try to show them how to do it safely. It's sort of changing that, we try to increase their knowledge and hope that we can change that attitude that they may have, that I'm just going down the road, probably nothing will happen, don't need to buckle up, which is, a long-standing attitude for, I think, a lot of us. I know even, when I was growing up, that was the attitude. So we have initiatives now to sort of see if we can alter that attitude just a little bit in hopes to altering their behaviors of buckling up and buckling the kids up before they take off. So absolutely.
Thank you. And just to follow up with the seatbelt piece of that, we did have another comment come in from Fatima Hood that said that Fort Berthold Reservation in Newtown, North Dakota also has a primary seatbelt law. I know we were discussing that a little ways back in the webinar. And she was fortunate to work closely with the MHA Highway Patrol and pass that law in October of 2015. So if there is anyone who is trying to pass a primary seatbelt law and might have some questions, if you do email us or let us know in the chat pod, we can get you in touch with her so she can share some of her experiences for you. Unfortunately, she is not unmuted currently. So to go back to that last question, though, that we just had Robert answer, could we also have Joe, could you talk a little bit about that too? Have you guys been focusing on seniors or mature drivers as well in some of the things you're doing?
Yes, thank you. We've been in our crash statistics, we've been tracking we call them the elderly drivers, just to see how those percentages are moving around, because we know it's a rapidly growing area. Also, we have a large percentage of people that are aging in place, and so we know there's an emerging transportation issue, and so we're tracking those statistics. We also work with our social services department that runs basically a little transit service called Transportation Reaching People, and so we've talked with them about making sure they're meeting their needs in terms of being able to provide rides. But I see this as one of the emerging issues that we'll continue to want to focus on. So far, in terms of representation in crashes, the elderly population is actually doing pretty good. They're slightly overrepresented, but not drastically. But it is definitely something that we're monitoring. So it was a very good question. Thank you.
Thank you. We have another one directed to all of our presenters. And I'm not sure who would be the best to answer this one, so I'm going to put it out there and let the four of you decide who would like to go first. Typically in our region, public walks and paths adjacent to roadways are typically jurisdictionally transferred to the local municipality for continued maintenance after the initial construction. Often the cost participation for initial construction or even the added maintenance responsibilities is a hindrance for a local municipality to support, especially with ADA and possibly PROAG requirements. Are there any special strategies you have used to help make more walks and paths constructible? So perhaps Joe, that might be in your ballpark.
Yeah, that's a good question. So sometimes what has happened in our case is we'll do road improvements and then the other city may not want to take the road because of those very issues. And so the maintenance of those facilities is a challenge, and it's really, as I see, part of this transformation for public agencies as we shift from being roadway or highway agencies to transportation agencies. And I think it's still a piece that's being worked out. In addition to those types of facilities like landscaping and other things that are an important part of making a facility user-friendly for particularly people walking, and sometimes bikes is also a problem for us because of that maintenance. And so I think it can be a hindrance, and I think it's definitely an open chapter that we're continuing to still try to sort out how to make it work, because we know we need to provide the facilities. And in some respects, the funding strategies haven't really caught up with the changing in the system and the way we're looking at our transportation system.
This is Sallie.
Thank you.
Can I provide a little input? We have locally our Pikes Peak Rural Transportation Authority, which is a 1-cent sales tax that goes towards transportation projects as well as ongoing maintenance and actually transit. Through that, both the city and the county have been able to install more ADA pedestrian ramps, do some improvements, and some of those dollars can be used for ongoing maintenance for trails. In addition, the city of Colorado Springs, and not the county necessarily, but has a trails and open space tax that goes towards not only buying open space, but now they've modified it to allow more ongoing maintenance. But it is a struggle because when you pass, for instance, an open space tax, you have a lot of focus on buying new open space, but then there's no money to provide the ongoing maintenance. We have worked very collaboratively, though, with the county and the city and our municipalities in developing master plans that connect our trails so that when you leave, let's say, a county jurisdiction that's in an unincorporated and you hit the city limits, that those trails match up and that you have these agreements in place to maintain the trails so that, because a person doesn't care whether they're in the city limits or whether they're in the county and unincorporated, they just want to be able to walk. But that ongoing maintenance piece is critical to make sure that as you look at potentially passing new tax initiatives or looking at funding these kinds of facilities, that there is a maintenance piece to it in order to provide that connectability.
Thank you, Sallie. And going with the funding piece, we did have a question that you had actually posed that we'll go to next. And are there opportunities for funding if the scope of stakeholders is expanded to public health and transportation collaboratively? I know we've talked a couple times about transportation-specific funding or public health-specific funding, but if they're collaboratively, is there some funding sources out there that can be used? So Howard, do you have any input into that one?
I touched on that a bit ago when I was talking about the public health money that was made available to each of our 13 regions, and unfortunately only one of them took advantage of it. But when I think back to recent years And the idea of everything we're doing in highway safety, it comes from highway safety agency funding, highway safety improvement plan funding through DOT, the public health funding, the All-State Foundation. We get money each year from AT&T to help us with our distracted driving it can wait efforts. We have been quite creative in finding financial resources. Of course, there's never enough resources, never enough dollars within those resources because of the competition related to, everybody would like to have a little bit of it, I guess. But the fact is, I think you have to keep looking, and there are opportunities, and it just takes some hard effort to find them.
And Rob, are there any other funding sources that you guys have used other than the ones that Howard has just mentioned?
Yeah, on the reservations, we sometimes take advantage of some of the Bureau of Indian Affairs, Indian Highway Safety Program funding, Governor's Office of Highway Safety, Federal Highway Administration. I think the question asked earlier about walkways, on some of our communities, especially here in the Southwest, walkways or even shoulders are rare. But we have been able to take advantage of this Safe Routes to School funding initiative, which has done a really good job at coming in on year one and assessing the community, designing a plan, and in year two actually funding it and constructing it, building, basically sidewalks from communities to schools in our community. So I'm not sure of the how long that funding is going to be around, if it's still in existence, but that was a big help in our communities. But yeah, like the others have said, finding funding is almost as hard as solving the injury problem. So it's a continuous effort, ongoing, and it changes for us year to year, the sources.
This is Sallie. If I might, I don't, I guess directly I don't know of additional funding sources, but it certainly begs the question of how have we in my community looked at some of those types of funding through public health that we may have missed. And I think that is something that I'll go back to my public health director and ask, have we really looked at some programs that we might be eligible for that may not be under the traditional transportation opportunities under essentially our county engineer staff. So I think that this begs the question as how we should broaden our thoughts as well as local officials to say, hey, did you think about looking for some other opportunities that may not have been so obvious at first glance?
And this is Howard again. To build on what Sallie just said, one source that I failed to mention is State Farm. And State Farm has a fair amount of money that they give us each year, primarily for teen driver-related issues or just teen health-related issues. And I know that they have money that is designed to be distributed equally throughout the United States.
This is Rob again. What I failed to mention, it might have been covered, is some of the things that we do is we help lobby to get public health initiatives on funding applications, especially at the state level. Many states have funded public health programs that are funded through the CDC, and traffic safety initiatives are certainly allowable line items, allowable goals and objectives, but I don't think they make their way there unless there are groups lobbying for it and showing the need for it. So that's been a big help for us in the past too.
And this is Howard one more time. Just it's not always just looking for dollars, but it's looking for programs or training opportunities that might help you to implement various efforts in your state. For example, as we were beginning the Teen Driver program some 4 years ago, we were one of 8 states chosen to spend 4 days in Atlanta through the Safe States and CDC for evaluation training, and then after the time in Atlanta, we had to spend X number of months, I think it was 3 months, to develop a solid evaluation plan for our teen driver program that has served us well. And if it wasn't for the fact that they paid for that training, we probably would never have had it. And there have just actually been a number of opportunities like that. The Children's Safety Network, for example, we're currently involved. I think there are 12 states that were chosen, involved in an educational program of the states sharing with one another over the next 18 months.
Yeah, this is Joe, and what I found is, we've received some funding from Oregon Health Authority when we did our health impact assessment and road safety audit, but for a lot of the health agencies, whether it's your state or even your county, it's a little unconventional. So it takes a little bit of marketing to help folks understand the linkages. And then what I've seen is when people understand it, it's kind of like this light bulb goes off and they become very interested. And so it's really very innovative, but sometimes it takes a little effort to get that across. So I envision that there's going to be more funding opportunities as we begin to do a better job articulating how health and transportation and really this holistic approach to safety are really linked. And so it's really, in my mind, a very, very exciting time because it's really the kind of the start of a new frontier in safety.
And as elected officials, I think we have an opportunity to try and break down the silos and get different people to the table. When I think about the fact that Human Services falls under the Board of County Commissioners in Colorado, and in many states we deal with child abuse prevention and those kinds of programs, but maybe bringing some of those folks to the table with public health, with transportation, with public safety, which could be traditionally law enforcement, that is the district attorney's office or the state's attorney, trying to get all those folks to the table. That's the ability for us to call a meeting and get the right folks there, whether that's the judicial system or whether that's transportation or public health. And I think that's an opportunity that's exciting to me as someone who serves as an elected official to say, I have the opportunity to know everybody and bring them all together and put them in put these initiatives maybe in our strategic plans so that it makes sense and continues from year to year.
Thank you all. I think that was really helpful, and I think that Sallie's mentioning that she's going to go away and take a look at some of these other programs is a great call to action for everybody that's on the phone too, is to take a look at what you're already using, but maybe some of those things that you may have missed that could also be helpful for you. And our 4 panelists just described a whole slew of different programs and funding sources, so hopefully some of those you weren't aware of beforehand and can go out and take a look at them and put some of those into place in your community. It is 12:30, and that is the time that the webinar was supposed to end. I do apologize again for us having some technical issues at the very beginning. We do have one final question in the chat pod that I am going to address at our presenters, and then we will wrap this up because I do want to be cognizant of everybody's time. The last question that we have is that alcohol and seatbelt initiatives have been mentioned. Are there other public health priorities for your organization? For example, speeding, active transportation promotion, et cetera. Joe, do you want to get started with this question, please?
Sure. In our safety action plan, our 3 emphasis areas are roadway departure, lane departure crashes, young drivers, and aggressive driving. And we also do have a pretty strong active transportation program that we're also working on quite a bit. So those are really kind of the top areas for us. And then there's a whole slew of other areas that we're always keeping our monitoring and keeping our eyes on. It was interesting that Sallie mentioned the suicide. I'm actually working with our suicide prevention person because we've had the same issue on our roads. And I see opportunities to really create a very diverse zero program. So, zero fatalities related to suicide, car crashes, other poor health outcomes. So it's very intriguing to think about how all this can be integrated better. Thanks.
And Sallie, would you like to address this one as well?
Well, interestingly enough, NACo, National Association of Counties, has been working across the country with a wide range of partnerships to promote local road safety. But I wanted to mention that Asante County, located in rural Minnesota, launched a Safe Cab program in 2005. And that program, which was a collaboration between law enforcement, bar owners, and cab companies, provides free rides home from bars 4 nights per week and reduced drunk driving in the county by 67%. So I think what we'll see is if we reach out, there are a lot of local organizations and local governments who are doing great things that we may not even know, but if we can share some of those between states, between counties, we are able to then implement things that may not cost us more money, but actually move the needle in saving lives. So I think that that's an important thing, is to look at and share those innovative programs and figure out a way to do that as to how we can make an impact locally and not reinvent the wheel, but take someone else's ideas and implement them in our local communities.
Thank you. And Howard, do you have a few final comments on this question too, please?
I do, thanks. Alcohol has been a significant problem, of course, around our country. But one of the things that New Hampshire did about 4 years ago that has made a significant difference as far as benefiting what our law enforcement folks can do at a crash scene or just at a traffic stop is that the new law changes the wording of alcohol to anything natural or synthetic that can impair you or does impair you, kind of stuff. So, you know, when you think about the heroin and fentanyl epidemic that we're having in New Hampshire and around the country, to know that law enforcement can address that, we have an expanded drug recognition DRI program in the state. I think we have one of the highest numbers of DRE experts considering the total number of our law enforcement folks. And then the whole distracted driving hands-free initiative, it's not nearly enough. We've got so much more to do in that area. But again, we've been able to drop distracted driving from the second leading cause of fatal crashes to the sixth, and that's a significant outcome.
Thank you. And Rob, do you have any final comments?
Oh, sure. Yeah, absolutely. Along with alcohol and drug-related issues, speeding, distracted driving is one of our big initiatives. We have a community here locally in the Phoenix area that's the first tribe in America that's enacted the no texting while driving law on the reservation, and they're right here in Scottsdale, Arizona. So we hope to see some good things from that, because distracted driving has really, really started to jump up on the charts as the contributors for our crashes.
Thank you. And so I do want to take this time to thank all 4 of our presenters and panelists again. I think you guys have shared some excellent information today, and it was very diverse. So hopefully our audience got a lot out of today's webinar. This webinar has been recorded and will be available on our website within the next couple days. The slide that you should see in front of you right now is a list of the resources that we talked about earlier. It includes the Safety Center's webpage, an introduction to safety culture video that we did create through the Safety Center that you can use in any way that you see fit, the FHWA Health and Transportation webpage that I mentioned at the beginning of the presentation, the Towards Zero Deaths program website, and the FHWA Health and Transportation tool that Joe had mentioned at the beginning as well. Again, I will point out that in the bottom right-hand corner, you can download not only today's PDF, but also the other 3 reports that Joe had mentioned at the beginning of the presentation as well. All of these, again, will be available on our website with the recorded version of this presentation. So if you don't have time to download them right now, you will be able to find those after the fact as well. So today in our webinar, we hope that you have learned how to identify how an engineer or planner can incorporate health into the transportation plan, to understand how an elected official can affect public health and transportation, to list strategies used by an injury prevention specialist to improve public health in transportation, and to identify specific strategies and resources that can be used for tribes. Our upcoming webinar will be August 10th, and this will be Towards Zero Deaths Through Improved Traffic Systems Management and Operations and Rural Emergency Response. Again, this is the one that I was mentioning that we will have law enforcement as well represented at this webinar, and it will be a webinar co-hosted with the National Center of Excellence for Operations. We also have our National Working Summit that is coming up in September in Denver, Colorado, and Sallie, who was on the phone with us today, will also be presenting at this summit. The agenda is now available, and you can find out more on our website. Registration is open for this. And we do have contact information as well for our presenters if you do need to get in contact with them again. Because we are short on time, I will not do our poll questions, but we will have them in our evaluation that will be going out as soon as the training is over. So if you guys wouldn't mind taking a few minutes to fill out our evaluation, letting us know whether or not this particular format for the webinar worked okay, other than the obvious audio technical issues that we had at the beginning. But if you liked this format of being able to ask questions of panelists versus just being having presentations done for you, if you could fill out that evaluation and let us know, we would appreciate it. So thank you again. I really do appreciate Joe, Sallie, Howard, and Robert taking the time to present today. Thank you, everyone.
Thank you.
Take care.
Thank you.